Welcome to today's press briefing. We have with us Head of Communicable Disease Branch of the Center for Health Protection, Dr. Chuang Shok-kwan, and Chief Manager of the Hospital Authority, Dr. Larry Lee. They will give us update about the situation of COVID cases as well as the situation in TMHK. Dr. Chuang, good afternoon. Yesterday we have a total of 3,019 positive cases, including PCR cases 1,217 cases and 1,802 RAT verified cases. We have 237 imported cases, including 224 PCR positive cases and 13 RAT positive cases. Number of deaths is, as reported by the TMHK, there are 4. In the fifth wave, we have 9,231 cases. We'll now hear from the Hospital Authority about admissions. Good afternoon. We have altogether in the TMHK 1,190 patients being admitted, of which 152 of them are new cases. We have 373 patients are in isolation wards and 24 in second-tier isolation ward and 386 patients in the North Lantau Infection Control Center. We have 120 new cases in the ICC. And there are 4 patients in a critical condition, 2 with 3 doses, 1 with 2 doses, and 1 without any vaccination record. There are 6 patients in a serious condition. Altogether, we have 20 critical condition patients and 40 patients in a serious condition. 7 of the critical condition patients are in the ICU. There are 4 patients that have passed away, 1 male, 3 females, between the age of 90 and 99. 1 came from the care home. Is a 92-year-old female, 1 with 2 doses, 1 with 1 dose, and 2 without any vaccination records. I'll now start with the first case. Is a 99-year-old female with 2 doses of vaccination. She did not suffer from any chronic illnesses. Family members found that her RAT was positive. She was sent to the A&E at Eastern Hospital. On the 8th, in the afternoon, she had a fever and lethargy. X-ray was taken. There was no opacity in the chest. The CT value of the PCR was 17.3. She was admitted in medicine ward. Starting from the 10th, her situation deteriorated, including a drop in oxygen level in blood. On the 18th, in the morning, she passed away. The second case is a 96-year-old male without any vaccination record. He suffered from chronic illnesses, inflammation in the gallbladder, as also renal failure. On the 26th of June, he was admitted via A&E Queen Mary Hospital. He had fever, coughing, as well as opacity in the X-ray chest screen. The CT value was 19. He was started with antiviral medication and his blood pressure was put under control. On the 30th of June, his situation stable and he was transferred to another hospital, F.Y. Yong. His white blood cell number increased. We prescribed antibiotics. And on the 17th of July, he was sent to Queen Mary Hospital because he needed more support in respiration. On the 18th in the afternoon, he passed away. The third person is a 92-year-old female. She suffered from arrhythmia, and she was staying in a care home. That was the case mentioned yesterday. She was admitted on the 4th in the evening via another hospital. She suffered from fever, shortness of breath, and a drop in blood oxygen. The RAT at the A&E was negative, but the subsequent PCR was positive. CT value was over 30. After she had been admitted, she was prescribed with antibiotics as well as other drugs, as well as steroid. She was sent to Tai Po Hospital for treatment. She was on oxygen support. Her situation deteriorated. On the 18th, she passed away. Last case is a 90-year-old female without any vaccination record. She also suffered from arrhythmia as well as high blood pressure. And about 5 a.m., she was sent to Nathasol Hospital A&E. The RAT was positive. She was resuscitated to no avail. She passed away at the A&E. We have 237 imported cases, including 122 cases picked up at the airport and 89 picked up at the quarantine hotel, and 26 are picked up after they've left the quarantine hotel. Of the imported cases, they came from 54 places. The following places got over 10 cases: UK 59, US 24, Singapore 18, Philippines 16, India 12, Canada 12, and for the rest 48 countries, they have less than 10 cases. In terms of care homes, there are 3 care homes with new cases. Close contacts will have to be quarantined. They are 輝圖護老院 at 屯門. 1 resident was confirmed. 6 residents as well as 1 staff member had to be quarantined. 樂善老人院, also 1 resident being confirmed. 10 residents have to be quarantined. 屯門友愛 nursing home, 1 resident confirmed with 6 residents being quarantined. Today is Tuesday. For schools, there are 385 schools reporting 498 cases. 408 of them are students and 90 staff members. They came from 93 kindergartens, 159 primary schools, 127 secondary schools, and 6 special schools. In the past 7 days, we have 229 schools with 2 or more cases. Today, there are 8 schools with individual classes that have to suspend teaching for 1 week. That includes 基維小學 in Ma Wan, Class 3B, 4 students. Sha Tin 英藝 Kindergarten, N1A, with 2 pupils. There are 16 in that class. Hong Chi Tuen Mun Morning Hill School, Class P3, 1 student. There are only 8 students in that class. 識識苑 Yuen Long Hong Shui Kiu 思道中學, Class 2A, 30 students with 3 confirmed. St. Thomas Kindergarten in Shek Kip Mei. In Ga Lok Nursery, 19 students with 2 cases. Yan Chai Hospital, Wang Hua Sang Zhong Hok Secondary School with 28 students, 3 confirmed. 中華基督教會全員中學 Class 4C, 28 schools, 28 students, 3 confirmed. And 香港靈糧堂 Kindergarten. It's a school bus, F1. It serves the morning session. 2 of the 17 students were confirmed. That includes 1 school nanny and 1 school bus attendant and 1 driver. And there were some classes in schools previously mentioned. Suggestions have been made to suspend classes, but there are other classes now. 廣舊交 is HKKWA 新方中 Primary School with 25 students, 3 confirmed. 聖公會主峰小學 Class 5C, 32 students but with 7 students. And Class 2B, 3 students are confirmed. They have to be suspended for 1 week. That's all for my report.
As for subvariant strains. For BA.2.12.1, there are 56 suspected cases. 33 of them are untraceable cases, and 23 others are related to other cases. For BA.4.5 cases, there are 30 suspected cases, 17 of which have links with other cases, and 13 untraceable cases. Well, we've continuously seen over 3,000 daily confirmed cases, and it's an upward trend. And in some other places in Australia and the UK, the burden on the healthcare system is getting heavier. And we're concerned that if the number of confirmed cases continues to rise, our public healthcare system would be affected as well. The Hong Kong government is striving not to impose harsher social distancing measures because of the high social costs, but we do not have the conditions to relax them further. So we appeal to everybody to observe the relevant measures. For example, keep your mask on and keep socially distanced, and also use the vaccine pass and Leave Home Safe app. And if you have any discomfort, please get checked and see a doctor as quickly as possible. And if you haven't been jabbed, please do so as quickly as possible. For the HA, in the past day, 141 patients recovered, including 121 who have been discharged. 7 patients were found to be positive via admission screening, and for patients sharing the same ward, 10 of them were regarded as close contacts. And as for staffers, we have 79 new cases. The total now stands at 25,287, and we have 20 more staffers returning to their positions. So altogether, 24,771 staffers have returned to their positions. As for the medicine ward for male patients in North District Hospital, we've identified one more patient via screening. The patient is a 70-year-old male patient in stable condition. He's now receiving isolation treatment, and so far 5 patients and 6 staff members, as mentioned yesterday, have become confirmed cases for this ward. The floor is now open. Please use a mic before you speak, and please introduce the media outlet you represent. This reporter, please. Yes, I'm from News. My first question is in relation to the number of students as confirmed cases and the number of schools affected. The numbers are on the rise. Will the authority suspend face-to-face teaching to avoid further spreading of the virus? Next question. There is also a suggestion by experts that by next month the daily caseload will increase to over 10,000. If there is a rebound, this will pose a greater burden on the public healthcare system. Are there measures to cope with the surge in the number of confirmed cases? For the number of confirmed cases in schools, the daily average is about 200 or 300, or some 300 cases. Some are reported today, some were reported yesterday, so altogether we're talking about some 300 to 400 cases per day. Territory-wise, we have some 700,000 pupils and teachers, comprising 660,000 students and 100,000 teachers getting tested every day. That's 10% of the total population. So the number of confirmed cases, standing at some 300, 400 cases a day, is in proportion with the total tally, population-wise. And we would like to avoid major outbreaks in schools as much as possible. So if we suspect that there could be transmission going on within the same class, for example, if we've identified 3 cases or more, there could be transmission within the class, albeit the index patient might have been infected in the community. So face-to-face teaching would be suspended, and they can switch to online classes instead, and this would help prevent major transmission in the schools. As for the number of confirmed cases, we have yet to identify an apparent trend. But in the past few weeks, we do notice a rise in the number of cases from some 200 cases to 3,000 cases a day. So the figures have doubled at times over a rather longer period of time, say 2 weeks. So we do envisage an increase in the number of confirmed cases. But we do not want to see a rapid increase in the number of cases, or else the healthcare system would be affected. The HA can supplement. We have a preparedness plan for the possible rebound. For example, we have a high-level coordination and command center for policy discussion. And as far as hospitals are concerned, we also have a plan in preparation to make available more beds. We have some 1,000 confirmed patients in our system, and at this moment we're able to cope, but if necessary we can make available more beds to cope with the demand. As for increasing the number of hospital beds, we have a real name rostering system, and if need be we can provide more hospital beds in the North Lantau Hospital Hong Kong Infection Control Center and more staff to support the facility. For those in home isolation requiring our support, we have designated clinics. We also have a hotline, and the latest initiative is that, as you know, we do provide teleconsultation service. So if any patient rings this hotline and if the condition is deemed fit, the case will be referred to the service, and there will also be prescription of medicine as well. We will conduct a timely review so as to increase our service capacity. Next question. Any other questions? This gentleman on the left-hand side. I'm from AM 730. Yesterday, you mentioned HKKKWA Fang Chung Primary School. There were 2 classes affected, and today 1 more class has been identified. Has there been any investigation to see if any environmental contamination, or is it just a coincidence? About the school bus of Lingliang Kindergarten, can you tell us more details? How many buses are involved? Is only 1 class or involved, or other classes? Are only 1 bus driver and 1 attendant affected, or other students also affected? As for the 99-year-old patient, is it because of the underlying condition, or is it to do with COVID? As for the 2 cases, 96-year-old and 92-year-old patients, did their test result turn negative before they pass away? For Sun Fang Chung Primary School, we tried to find out if there had been any gathering or other school activities, and so far we haven't identified any instances of transmission. There are cases in 3 different classes involving different students. We will continue to investigate and see if there are other reasons. As for the school bus of Lingliang Kindergarten, 1 bus driver and 1 nanny have been infected, and altogether there are 17 bus riders, and we've advised them to suspend classes at the moment. As for the 99-year-old female patient, she did not suffer from any chronic illness. I'm afraid I don't have further information to provide in relation to her condition. As for 2 other cases, for the 96-year-old male, long-staying patient in Queen Mary Hospital, indeed the test result turned negative. But in relation to a patient infected with COVID, this is not unusual, especially when there are fluctuations following the initial infection. As for the 92-year-old female patient, she had several rounds of PCR tests done on admission. For the first 2 tests, the CT values were quite high. On the 3rd testing, however, the CT value dropped. We believe that this could be a reinfection, and that's all I can provide at the moment.
Over there on the left, at the back row. I'm from Ming Pao. First of all, I'd like to ask about the class 3B at Ma Wan, Giwei Xiuhe. How many students are there? And for Jufeng Xiuhe, Are there any links in the class announced today and the class announced previously? CHP said that if there are 3 cases in each class in the class, then they may consider asking that class to suspend teaching. So what is the criteria? 3 cases in the class or 10% of a student population? What is the assessment of the CHP? At what level do you think that a school should suspend classes? And I'd like to ask about death cases at the HA. What cases are related to COVID? Were all these cases prescribed COVID medication? What is the coverage of COVID medication on these cases at the moment? For CCCKY Primary School, there are 29 students in Class 3B. For Jufeng Xiuhe, there are 2 classes. There is 1 student who is the brother of a student in the other class. But for the other class, we have not yet found any link. I was talking about 3 students because most of these classes have about 20 students or so it's about 10%. But of course, it depends on the gap between the confirmations. We think we would consider suspension whether there is a high number of students. There is no hard and fast rule. For the cases of death, there is this 196 male that has a record of prescription of antiviral medication. For infection cases among the elderly, unless there is a special condition that render the case unsuitable for antiviral medication, we would prescribe it. As at the 14th of July, we have prescribed 30 to 34,800 cases these medication. We will monitor the situation. The one on the left. I'm from cable TV. First of all, about the cases. The one with the school bus, with the driver and the school bus attendant being confirmed. Any classes that have to suspend teaching, and for the Sing Kong Wei Holy Spirit Primary School and the Sun Fung Zhong Primary School, any links? And for the 92-year-old female, is it a reinfection inside the hospital? We see cases of patients passing out in their own home and then die. Do you have any advice to the general public to avoid such cases if they suffer from certain symptoms? For the Lingliang Church Kindergarten, there is 1 school bus attendant and 1 driver that have been confirmed. So far, no students or no pupils yet. We suggest that pupils who take that school bus should refrain from going to the kindergarten. They come from different classes. For Holy Spirit Primary School, there are altogether 3 classes so far. 2 of them involved 2 brothers studying in 2 different classes. There might be some link. For the other class, we have so far not found any links yet. You ask about a 92-year-old female. At the time of the admission, that is, on day 1, the PCR test was positive, CT value 35, and on the 5th, that is the 2nd day, it was similar. On the 3rd day, the 6th, it dropped to about 25. Judging by that, we think that if there is a drop within such a short time, it doesn't look like an infection within the hospital. It looks like a reinfection from the community. Next, the report on the right. For the San Fang Chung Primary School, now we see new cases. So for the 3 classes, who is the first case? What is the date of the onset? Talk about the Ling Liang Church kindergarten cases. Well, you talk about different classes as well. Where are they? And for 13 cases in Sheng Chun House in Sochun O Estate. Do you have any information about how many families are involved? Any vertical infection within that block? I don't have detailed information about the cases you talk about. For the San Fang Chung Primary School, on the 15th of July, students from 3 classes have been confirmed, but we asked them to suspend classes before there were more cases. For that school bus, pupils came from different classes, but so far there is no cases among pupils. That's the end of the press briefing. Thank you. We don't have the conclusion as to whether it is common or not. But if family members spot any abnormality, then they should send them to hospital. For emergency cases, we'll deal with them in a very professional way.